open this up to the wider market. And it's a very, very good point. It's effectively something which we've done here in some sense. Sister is saying that, you know, is this something we really want to do? Do we really want to open the doors and let everyone in when, you know, effectively, you know, we haven't cleaned the house? You know, we don't want to invite everyone in when the house is messy. So effectively, in the field of hijama, we have a lot of messy things going on in the context of the practitioners. Maybe they're not up to scratch. The premises, maybe our own practice. First of all, looking at ourselves and what we're doing, are we operating at a level high enough, ready to kind of bring in kind of your local police officer to come in, have hijama done, your local health and safety officer to come and have hijama done. Alhamdulillah, we've got patients here who fit into those categories. But to be honest, when we first started, what we were doing, when I first met Shuaib and I treated those first initial 10 patients, I would probably arguably say, or admittedly say, that I probably wouldn't have been comfortable at that time saying, okay, well, let's bring anyone and everyone in and let's get started. Alhamdulillah, we worked very quickly with developing a framework and trying to meet ideals which are kind of universal to any health field. But it's a very good point. But going back to where Brother Shuaib left off with some of the statistics, there's 2 million plus Muslims in the UK, 6 million plus non-Muslims. So first of all, 2 million plus Muslims in the UK. Just if we look at the Muslim population, I don't think there's enough ICAT hijama practitioners, and I definitely think there's not enough kind of overall hijama practitioners, first of all, to meet that need. So I think one of the sisters said, you know, I'm setting up in Leicester, we're going to be competition for you guys. We want to look at it in the context that, you know, we're not competition for each other. We need to get one thing straight. We're not competition for each other. We're working together to push this forward, okay? Because there's not enough hijama practitioners to go around. Even if every single one of us here went and set up a clinic in Leicester, we still wouldn't have enough people here to satisfy the need of the Muslim population in Leicester alone. Okay, so I wouldn't think about this in the context of competition, because if you are, you're competing for the same piece of bread, okay? Whereas there's 1,000 other pieces of bread out there, and you want to compete for the same market. So what we're saying is we don't need to compete with each other. We need to open our eyes and realize that there's lots else out there. And if we open our strategies up, then we open our potential up. If we keep our strategies closed and just expect patients to walk through the door and not do any promotional work, not do any kind of enlightenment of the population about hijama, and we say that do this with all other aspects. Bring all other health-related matters into it. Go and help, encourage people about health management and educate them on how hijama can potentially fit into that. Okay. So this is effectively where we're going with that. So as Brother Shuaib said, is the name a hurdle? Is it that it needs an oil change? I had one of my patients who's on one of the videos that we have. I'm doing hijama on him. He's a businessman who's very successful in what he does and so forth. And he said, you know what you need? You need a different type of name. You need to call it something else. Something. Give it a name. And so okay, but I don't know. I wouldn't 100% agree with that. Maybe the name isn't a barrier. If you feel like it's a barrier, sometimes I feel when you walk into a room and there's loads of non-Muslims, if you feel like they're all looking at you, then they probably will all look at you. But if you go into the room and you just act normal and behave normal and don't have any reservations, then no one will really have any reservations. So I think sometimes we can inbuild our own kind of reservations and our own limitations. Effectively, yes.
Just allow me to express my own experience about hijama and what problem I faced, and I believe could change all this situation and could make the strategy how to really, just let people know about hijama. First of all, I was trying to find any place to give me hijama 5 years ago, and I couldn't find any professional. Actually, first of all, the name itself, H-I, different than H-E, and this is very, very important. If you can solve that through the SEO or C-E, there's a lot of pronunciation for that, especially for Arab people who live here, which I believe they are really a lot. And people used to search by hijama by the Arabic word. This also has a very lack of information, and it's very confusing for everyone. I believe first we have to hire someone like SEO specialist And
So, I do understand completely what you're saying, that maybe people don't even know what the word is. People don't. There's no standard spelling of hijama. There's no. Maybe we need to enter it into the dictionary or something. We can put an entry in or something. But there's no standard spelling of it, which is fair enough. But then for everything, when you type in acupuncture, there's different spellings for it, and things will come up when you type in various things. But what I'd like to highlight on that is hijama is known as Beckham. Hijama is known as Ventouse. Hijama is known as Janja. Hijama is known as Tobin, and so many different things in so many different languages, and I think it's universal in that context, and I don't think a name has ever limited it. So in that context, I don't think it's a massive issue, and by keeping the Arabic name, we keep effectively its kind of its origins, and that could be an issue or it couldn't be an issue, but that's just a discussion really, kind of helping people understand. And to the layperson, sometimes when you say, yeah, it's like an oil change for the body, sometimes it's for me it's like a bit like, oh, well, it's a bit difficult for me to say that to a patient, but sometimes with the right patient that might be the right type of terminology. Research, I think definitely this is a way to push it forward, to separate the men from the boys in relation to the therapy itself. I believe that we have solid scientific kind of things that are happening under the cup. There's definitely changes in physiology and so forth that are occurring, and we can prove that, I believe. So we can kind of discredit just a placebo effect or just a kind of pain gate theory. Media coverage. So what are all these other associations doing? What are all these other therapies doing? Effectively, the difference between them and us is that they have a dedicated professional body who is completely dedicated just to promoting the therapy. Okay, so they're there just for the sake of that. When there's something happens in relation to acupuncture, okay, can we have a spokesman from your organization? What do you have to say about it? When there is going to be some bad publicity about hijama, who are they going to call to speak? If they call ICAT and we're like, oh, hi, sorry, no, we only have 2 staff who are part-time, work 1 day a week between 3 and 4 o'clock. Could you fit in the interview at that time? We're not really going to be able to, that's not going to happen. So these organizations, they have dedicated staff, dedicated people who it's their purpose in life to do that effectively. That's their job. That's their job role. So in terms of the media coverage and this kind of stuff, we need people who are actively involved. Shoaib has been specifically given the task because of his specialities in internet marketing and various things to help generate this awareness. And inshallah he's going to be kind of assigned to do that. But overall we need to be prepared because really our competition is the big pharmaceutical companies and things who in some opinions you might say they want people to be sick. They want people to be ill for long periods of time so that they continuously take medications and so forth. So again, this is not this whole battle between medicine and hijama and different approaches, because we are all for an integrative approach, but we're not for managing chronic cases with just medication when there is other options out there. So we discussed that previously when we talked about integrative medicine and so forth. So we have to be prepared, because if we do have any forms of kind of negative media, anything like this, then we need to be ready for that. In terms of the regulation, we need to be ready for that when they come, if they come, and if there's an issue, we need to be okay. Well, we've got everything ready, and we're ready to formulate under statutory regulation or whatever it be. We've got our own systems in place. Accreditation, association, promotion, and defence in public arena and media. And this is again where we root back to really every time we come to these kind of, we look at these strategies, we see that the only options really are to formulate together a general pool, a network of an association which works with both with the responsibilities of a professional association, as well as kind of the regulatory roles and all the others. So there's many kind of tasks involved in this one organization, and this is only going to be created by yourselves. So this is a representation for yourselves, and it's you yourselves who are going to be part of that effectively, and by contributing into that. Okay. So any questions quickly before we move on to whose presentation? Yeah. I think Sister.
You have a question by Dr. Gab?
I just want to ask, why we didn't consider the masjids as one of the main media we can use in the meantime.
Yeah.
Actually, think about 2 million Muslims here. I believe if we could properly done this under the policy or recommendation as an ICAP, I believe it could spread them properly and could really get the knowledge.
Yeah, I think definitely there's a lot to work on in our own communities. So awareness of hijama in our own communities is low, and we need to work on that as well. But at the same time, we want to widen the horizon as well. We don't want to limit it to that, because again, if we only, I always go back to it, but my research was healthcare amongst ethnic minorities. And it was particularly looking at alternative healthcare amongst ethnic minorities and private healthcare. Now, both with alternative means and private healthcare, from the research that I did in terms of the surveys and statistics that we looked at, the majority of ethnic minorities were more open to alternative therapies than any other group. Okay, so if you're not the standard kind of UK-born, UK-British kind of through generations population, then you are less likely inclined towards non-conventional means of medicine. So the statistics showed that our communities or ethnic minorities were more likely to take up alternative healthcare, but they weren't targeted with the healthcare. So first of all, we have a niche market here. We have a market where people, they want help, they need help, and they're more open to help than anyone else. The seeds already planted in terms of the sunnah and so forth, yet they don't know about this and no one's trying to market towards them. So yes, definitely we need to hit our own communities and so forth, but at the same time we don't want to just be so specialized in the way that we approach our communities. We need to look at the wider spectrum, because never in Islam has medicine been limited to a Muslim population. It's always been opened and wide to the wider community, and we don't want to discriminate in the sense of that. Drum roll. I think we've got the next student up.
So looking at the previous presentations, I've just realised that I do have a bit of information overload on my presentation, so I'm not going to go into it into a great depth of detail. I'm just going to literally skim through the slides, otherwise we're going to be here all day. I'll just press. Okay, so my name's Amber. So my first case study was that of a 62-year-old female of Pakistani origin, average height and weight, but carried a lot of fat around her waist. She was diagnosed with pseudodementia, very friendly and chatty, but did talk a lot about her traumatic life. She came to me with 2 skin conditions. Firstly, nodular prurigo, which had affected her back, her legs and her arms, and palmoplantar keratoderma, which had affected the plantar surface of her right foot. The palmoplantar keratoderma was very painful and uncomfortable for her to walk on. Both conditions were very itchy and dry. She prescribed various topical steroid creams and antibiotics. She used aloe vera gel and olive oil, all to help to try to soothe and relieve the symptoms. So her health screen, she was diagnosed with wound cancer, diagnosed with pseudodementia in 2013, so she suffered with mood swings, memory loss, confusion, loss of appetite and aggressive outbursts. The treatment recommended was antidepressants, but her family opted to go down the route of trying herbal medication instead. Additional health problems were cholesterol, borderline diabetes and allergies. So just to briefly go through her conditions, nodular prurigo is basically a condition where the constant itching of the skin causes changes in the structure of the skin, which result in very firm itchy bumps on the skin surface. That's the treatment. Palmoplantar keratoderma is a disorder which causes the palms and the soles of the feet to become abnormally thick, and this is caused by genes which produce a faulty protein which affects the structure of the skin. So these were the various medications that my case study was taking for her various conditions. There's some herbal medication there that she had been recommended by a herbal doctor. So on examination of my patient, there was even distribution of small red elevated nodules all on the surface of her arms and legs and back. This was quite apparent because she was quite bare-skinned, so the sensitive skin was quite obvious compared to the rest of her body. The keratoderm on her right foot, there was thick yellow callus skin throughout the plantar surface with deep incisions throughout. Her blood pressure was slightly higher than normal, but still at an acceptable level, and there was no apparent signs of anemia. These are just some pictures of her skin, and it was not very clear, but she had quite severe keratoderm on her toes, very thick, and some cracked heels there as well. So the considerations I had to make before commencing hijama were her very sensitive skin. So I would avoid cupping on broken, sensitive and damaged skin, and her elevated blood glucose levels, which again could hinder healing of the scratches and also make her susceptible to infection. So I did stress the importance of keeping the area quite dry and making sure that she didn't itch the areas where I had cut. So this was my plan of treatment. I chose to do sunnah hijama of al-kahil and al-aqtain. Again, this would be beneficial in removing toxin and waste around the core organs, which I believe were affecting her circulation and weakening the immune system. And by improving these two faculties, I hope to improve her dermatological conditions and also help reduce her cholesterol and her diabetes. I also cut on the sides of her neck to help blood flow freely to the brain, nourishing the brain and enabling the nervous system and thus the whole body to function properly. Lastly, I cut above her lateral malleolus to basically stimulate an immune response in this area and to promote and encourage healing and assist the veins in diverting toxins away from the area, and also removing any kind of irritants or toxins that were aggravating the skin. And I also